to another Journal Club session. This presentation was created by Lucy Nganga as part of the Master of Nursing in Child Nursing program and narrated by myself, Ilana Weber. Let's dive in. This month's article is titled A Scoping Review of Mother-Child Separation in Clinical Pediatric Settings. It was written by Power et al. And published in the Journal of Child Health Care in 2021. Hospitalisation is a known source of stress for children. Research, however, indicates that having the mother present is crucial in helping infants and possibly older children with their autonomic regulation. Insights from developmental psychology and infant mental health highlight the mother's presence as a stabilizing factor. Neuroscience research utilizing advanced imaging techniques and validated measures of the autonomic nervous system shows that the physiological systems of both the mother and the child are closely interconnected. This growing body of evidence shows that a mother's presence is both comforting and biologically significant. However, these findings have not yet led to meaningful changes in pediatric care practices or research approaches. Previous research at a tertiary care facility in South Africa investigated the impact of maternal presence on infants by measuring infant heart rate variability and cardiac impedance. Researchers cautiously concluded that maternal presence may help stabilize infants' autonomic dysregulation. However, this conclusion was tentative because the study had a small sample size and many clinical variables that couldn't be controlled for. The findings further suggest that infants experience separation intensely and that this may be detected through observable autonomic nervous system parameters. Some knowledge gaps were identified in that no reviews were identified that focused on separation of the mother and her older infant or child, and also not on the physiological effects of maternal presence during illness. Thus, the review extended the summary of evidence beyond the newborn period, aiming to identify existing evidence in relation to the separation of the mother-child pair in clinical pediatric settings. The authors were guided by the following questions. What are the contexts in which the mother-child pair is described as being separated? What are the reported physiological and psychological effects of separation on the mother and child? What tools are being used to measure the effects of separation? And lastly, what are the gaps in the knowledge base? A scoping review was conducted to see what evidence was available from current research related to the topic. To ensure transparency and replicability while limiting bias, the preferred reporting items for systematic reviews and meta-analysis, otherwise known as PRISMA statement, was used. Several databases were searched as well as grey literature. Search terms included physiological, psychological, infant or child, maternal separation, and hospital. For the inclusion criteria using the PCC concept, the population under study was mothers and infants who have been separated within hospital settings between the period of January 2003 and June 2018. They only included English publications and human studies. During the screening process, the search strategy yielded 1,473 articles, of which 1,342 were excluded, as they dealt with separation outside the hospital setting. 131 abstracts were screened, of which 73 full texts were retrieved, and the authors ended up fully analyzing 34 articles as they fulfilled the inclusion criteria. They then extracted relevant data pertaining to the effects of separation on the mother-child pair. They used the qualitative approach to accommodate variations in samples and methodologies. They defined separation as the mother-child pair not being together. During analysis, they identified three contextual categories of separation, namely separation of newborns, infants and mothers, separation due to intensive or special care admission, and separation due to care practices. We will now unpack each individually. Let's look at separation of newborn infants and mothers first. The physiological effects on infants when they were with their mothers and specifically during skin to skin were better stabilization on cardiorespiratory parameters, higher blood glucose levels, similar temperatures to standard care, decrease in pain scores, especially whilst breastfeeding, and they required less intravenous fluids and antibiotics. The effect on the mother physiologically during skin to skin was decreased maternal salivary cortisol and lower heart rate. The overwhelming psychological effect on the mother was significantly less stress, as high as 89% less. But what happens during separation? Infant outcomes showed increased heart rate, variability power, shorter quiet sleep, bradycardia, lower respiratory rates, lower temperatures, and lower blood glucose levels. What about separation due to intensive or special care? Physiological effects on a child was increased allostatic load. Allostatic load is the cumulative physiological cost of ongoing stress. When the child's stress response doesn't get a chance to switch off, the body starts to pay the price. They were more vulnerable with poorer outcomes. Psychological effects on the child included risk of developing disorganized attachment after neonatal ICU stay. Mothers, on the other hand, found it difficult to initiate and/or sustain breastfeeding due to the separation. Psychologically, they experienced anxiety, stress, sadness, emotional chaos, yearning to be with their baby or child, loss of bonding time, interruption to their mothering role, and they found a difficult transition to motherhood. The study found that older children experienced hospitalization more stressful without their mothers present. They were lonely, they worried about their families, and even felt like they were being punished. Parents felt helpless as they were not able to look after their child, and lack of control left them frustrated. The study identified the important role the mother's presence plays in mediating the stressful effects of hospitalization on a child. Findings suggest that separation of the mother-child pair in hospital is a harmful event that should be avoided as much as possible. How does and should this affect practice? Institutional policies should support maternal presence, and practitioners should identify barriers preventing mothers and children from being together. We have come to the end of the presentation, and now it's time to think about your practice. What are the possible long-term developmental implications of repeated separation during hospitalization? How can developmental care frameworks such as Kangaroo Mother Care support autonomic regulation? How does your current hospital policies contribute to mother-child separation? And finally, what about private settings? How can nurses advocate for zero separation there? Thank you for your attention. Look out for our next Journal Club session. Goodbye.